go in and we shave. Basically what we do is that we just kind of resect these two pieces of bone here. So we're effectively, what we're doing is we're taking the cartilage away.
Okay.
And then we use an implant that's normally made out of celastic, okay? And we just basically create a new joint, a new false joint.
Okay.
The advantage of this particular procedure is that it still allows, in fact, you'll have increased motion in your big toe joint.
That's option 3 we're talking about, right?
Right. This is the joint replacement. Right here. So replacement. Okay? That will still allow motion in your big toe joint and so forth. The disadvantage is the fact that implants can wear out. The problem is, I don't know if it would be 5 years or if it would be 30 years. But, depending
What's that based on? What's based on the longevity you're at?
Because it's a false joint. I mean, it's made out of
No, I realize,
plastic.
but when you say 5 or 30, what is the determining factor, rather it's 5 or 30?
Lifestyle, just, several things. Lifestyle, just the structure of your particular foot. Okay? Now, again, I can't give you a standard rule of thumb.
Right.
But most of the literature says these okay. This is orthopedic surgery. Yes, I'm a podiatrist, but ortho just means bone.
Okay.
Most orthopedic surgery is good for 15 to 20 years.
Okay.
Now, you may get 30 out of this.
Okay.
You may get 5 or 7. It just depends on circumstances.
Okay.
Okay. See, if you told me, Gene, I periodically play golf 2 or 3 days a week. I have a desk job. I would say we'd probably get 15 or 20 years. But you're lean and mean. You're telling me
I don't know about that, but yeah.
No.
Anyway,
okay.
But yeah.
You're lean and mean.
Well,
here's the deal.
Yeah.
You're an active young man.
Yes, sir.
And that's the only issue about it is like if you participate in ballistic sports or this is
right. Well, it's not so much even
it's material,
right? It's not so much even the activity that I do now. It wouldn't even come in. It's the fact that it hurts when I drive a car. It hurts when I wear a shoe. It hurts when I take my shoe off. It hurts when I sit at my desk. It hurts all the time.
Right.
So it's not even when I just do athletic activities.
Right. Now the other option that you have, okay, is a fusion, and basically what you do is that you still modify this joint, but instead of putting in an implant, basically what you do is you just take those two edges of the bone, you stick them together, and you put screws or staples in there, and the thing is that most fusions last a lifetime. However, for people that are active, like see again, if you told me I play golf 3 times a week, fusion is perfect. Yeah. But if you go out and say I like to shoot hoops once in a while, you know what I'm saying?
Right.
I like to go out, and
jog
a little.
Right.
Yeah.
Right.
The fusion's not the best thing.
Okay.
It has higher achievable results, but it's not the best thing. If you were 63,
fusion, right?
But at 43, or 42 or 43,
I'd like to get at least 10, 15 more years of activity out. Yeah.
Well, and now here's the thing. Okay. Let's say we get 20 years out of this. Then you're going to be 63. Probably at that time.
Then we go to 4.
Fit. Exactly.
Right. Okay. So, can you talk to me about the procedure of 3? In other words, is it it's an outpatient? I mean, how does that work? The whole procedure. I schedule an appointment here. It's a 1-day deal. What, I mean, would you walk me through it? Sorry.
Of course. Yeah, that's the next thing I was going to
Okay, I'm sorry. Yes,
no,
sir.
No. You don't have to.
Okay.
Okay. Look. So here's the step. Okay. There's kind of 3 things. There's what we call pre-surgery, surgery, and post-surgery, right?
Okay.
Okay. So pre-surgery involves an initial assessment, right? Then you will come back in a day or 2 before surgery, what's called your final pre-operative consult. At that particular time, you'll come in, you'll sign paperwork with me. This is an outpatient surgery. You come the day of surgery, you go home.
Okay.
I do all my surgeries here at St. Luke's.
Okay.
I have for 10 years. They know me, and so.
Okay.
Then you will check. Then you will do your pre-op check in the hospital. The day of surgery, I normally do my surgeries at 7:30 in the morning. I do them on Tuesdays. I do have availability of Fridays, but I prefer Tuesdays. Okay. Oh, on the pre-op, at the pre-op, if there's anybody that is going to be invested in your care, okay, then that's the day that they need to come in so that I can talk with them, because the day of surgery I just don't have time.
I understand.
Okay. All right, so then we do surgery. Now, if everything goes well, we'll basically have from 1 to 4 what we call post-operative visits. 2 days after surgery, 2 weeks after surgery, 2 months after surgery, and then this is a variable where maybe 3 months after surgery, we might just have to do a final check.
Okay.
X-ray. Here we remove sutures. Okay. Now, what will be your limitations? Okay. The first 2 weeks after surgery, all you can do is stand. Okay. No walking. Okay. So in other words, you can't walk on the foot.
Hmm. Will I have a boot on at that time?
Yes, sir. I'll put a boot on you when you come back in 2 days later.
So okay, I would use crutches. I just couldn't put any pressure on that foot. Essentially, what you're saying.
No, you can't walk on the foot.
Oh.
In other words, if you get from A to B, like if you need to brush your teeth or whatever, wash your face, you can stand. You just cannot cantilever that foot.
How do I work? How do I drive? How do I during those 2 weeks?
Well, do you have an automatic car? What kind of work do you do?
I'm in sales.
I mean, I have to tell you what is required if you decide to do the surgery.
No, I understand. Yeah, I just so essentially you're saying I'm down for 2 weeks. Then I'm almost home.
Well, okay.
If I can't walk, I mean, will I be in a wheelchair? I mean, will I be in crutches?
Yeah, you can use. I mean, you're healthy. You can use crutches.
Right.
I mean, if your job will allow you to get to locations using crutches, that's fine. Okay.
That's what I'm saying. When you say I can't walk, I'm asking, and I'm not argumentative at all. Well, why couldn't I walk with crutches and not put pressure on that foot?
Okay. Walking is no.
I'm sorry.
There's mobility and there's walking.
Okay.
Walking basically means you're using your foot to propulse yourself in your walking gait.
Clearly, yeah.
Mobility means I am mobile, but I need an assistive device, a crutch or a wheelchair or whatever.
Got it.
I mean, you're strong, crutches will probably be fine.
Yeah.
Okay. Then, for the next 6 weeks, okay, you will be in the walking boot.
Jesus. I'm going to be 300 pounds.
No, you won't.
I will. I've just lost 22 in like 4 weeks. So.
Okay, after the second week, then we'll begin some physical therapy to start reestablishing motion back into that joint.
Jesus Christ. Okay, so what would happen if I opt not to do anything?
It just get worse.
Can you elaborate?
Well, I mean, okay, there are 4 stages to this process. Okay, you're already at stage 3. That's the reason why these 2 things right here are not an option.
Okay.
You're already at stage 3. I don't have a crystal ball.
Oh, of course.
This could be another 6 months. It could be another 6 years. But if we get to the point to where there is no joint space at all,
right?
Because there's basically not only is the joint but the bone shot.
And if you just reiterate, if I opted for 4 from the beginning, and if I told you I had a desk job, I didn't exercise much, I was 63 years old, fusion may be the best option. If I opted for 4, though, just hypothetical, even now at 43, you're saying I couldn't jog, I couldn't walk, I couldn't, or it would just be
difficult.
When you say difficult, no, I understand. Difficult meaning pain. I'm going to have pain.
No, you don't have any motion in
Oh, I just wouldn't able to.
A fusion basically means I take something and I fuse it together. Just like if I were to weld 2 pieces of metal.
Totally. Okay.
That's
so
fusing.
So it couldn't bend either way almost. And if I go to 4. Okay.
Right.
So I don't even. So it sounds to me like it's 3 or nothing. Yeah, I don't have a choice. Jeez. Okay.
Well, this is the toughest thing that you need to assess. Okay, and by the way, there's no guarantees with any of these surgeries. Yeah. Okay, fusions can fail, joints can fail, and things like that. What I'm trying to share with you is that with the joint replacement, we're effectively putting a fake joint in your foot.
Got it.
So that technically you will have mobility at that joint. With a fusion, what I basically do is that I take, basically I'm fusing bone to bone, and I either put screws, staples, plates, depending on what is the best alternative
Right.
to accomplish that goal. Okay? There's one big difference between the fusion and the joint. With the fusion, you cannot walk for a month. So we're almost doubling everything that
In
is
terms
going
of the
on.
procedure, right?
Right.
So it almost
Because
sounds
we
like.
have to allow those bones to see.
So in other words,
like
if I thought the
break a bone- just one
sorry,
second.
yeah, yeah.
So if you break a bone, fusions, it takes 6 to 8 weeks for that bone to heal.
Okay.
So you would be balancing only for a month. You would be